This episode of CLPTV is brought to you by Leica Microsystems. Leica Microsystems brings histopathology laboratories and researchers the highest quality, most comprehensive product range. Hello and welcome to today's episode of CLPTV. I'm John Doherty. Here's a look at some of our top stories. Early test results show some positive news for those who suffer from Parkinson's disease. Details on a drug called Trialex later. And it soon may be easier to treat pancreatic cancer. Information on the progress of a new study is just ahead. Plus, drug testing becomes faster and more accurate. How Randox Labs is doing it later. But first, news on a new fatal organism uncovered by Abbott Technology. At the recent American Society for Microbiology Conference on Biodefense and Emerging Diseases, scientists from Abbott Molecular presented data showing the power of its IBIS technology and its ability to identify new pathogens. The presentation focused on a severe outbreak of an unknown disease in Afghanistan in 2007. 83 people fell ill and 17 died after eating camel meat. Researchers first suspected anthrax, but after extensive testing using the IBIS T5000 biosensor, they discovered the specimens tested positive for Yersinia pestis, a causative agent of the plague. The T5000 is a precursor to the Plex ID system, which allows researchers to characterize a strain, identify its unique genetic structure, and develop a microbial forensic marker that can be used for identification should future outbreaks occur. Plex ID is currently intended for non-diagnostic use, but can identify a broad range of bacteria, viruses, fungi, and parasites. Its anticipated public health and biodefense applications include epidemiologic research and identification of emerging or previously unknown agents. Leica Microsystems has introduced Leica Direct, a fast, easy, and secure way to purchase histology consumables and general laboratory supplies online. Tim Lyons is the Global Marketing Communications Director at Leica Microsystems. He says, "We are excited to offer customers a personalized online service for ordering our wide range of consumables. Leica Direct means customers now have 24-hour access, order tracking, recent order history, and flexible account terms. You can start shopping with Leica Direct today at www.leica-microsystems.com/shop. The rising demand for fast and accurate drug testing spurs Randox Laboratories to expand its product base. Last year, the Ireland-based company released a drugs of abuse array, adding to its considerable test menu of legal and illegal drugs. It can test for more than a dozen drugs with a single sample, including methamphetamines, cocaine, and several opiates. The drug analytes are grouped on a biochip to allow for consolidated testing. And this biochip array technology has been a groundbreaking development in the practice of forensic analysis. It takes far less time to complete tests, toxicologists can extract substantial information from a small sample, and it provides accurate results that can be relied on in court. A new treatment for Parkinson's disease may be on the horizon. Harbor Biosciences says its preclinical studies on Trialex are netting some positive results. Trialex is an anti-inflammatory small molecule compound believed to reduce inflammation in the brain. The study is using mice to determine if it is capable of crossing the blood-brain barrier. Early results show that it is. Trialex was found in 50% of the mouse brains. The Michael J. Fox Foundation is helping fund this study. Todd Scherer is the Chief Program Officer of the foundation. He says they are encouraged by this initial data and plan to continue the vetting of this novel compound in the hope of speeding its path to the clinic. To date, Trialex has been well tolerated when administered to patients with type 2 diabetes and healthy volunteers. The Surgipath Tissue Marking and Margin Dye Kit from Leica provides exceptional dye quality and consistency. Pathologists can rely on the outstanding performance of the Surgipath Tissue Marking and Margin Dye Kit when isolating specific areas of tissue and identifying surgical margins. The special formulation improves diagnostics with a viscosity carefully selected to avoid running and oversaturation. The tiered acrylic base conveniently holds a complete set of dyes, giving you more space in the grossing area. With a regular tip for high volume and a tapered tip for precise application, the dual-end applicator brings a convenient innovation to the market. Surgipath tissue marking dyes are another example of how Leica helps you enhance workflows to deliver better patient care. For more information, visit www.leica-microsystems.com. And phase 2 of a new drug designed to treat pancreatic cancer has started. Infinity Pharmaceuticals is testing a drug called IPI-926 in combination with Gemzar. The study is using patients with previously untreated metastatic pancreatic cancer. Right now, pancreatic cancer is one of the most difficult to treat and is the 4th leading cause of cancer death in the U.S. IPI-926 is an oral molecule that is believed to deplete the dense, fibrous stroma surrounding pancreatic tumors. Dr. Charles Fuchs is the director of the Gastrointestinal Cancer Center at Dana-Farber Cancer Institute and a professor of medicine at Harvard Medical School. He says this drug may alter the tumor microenvironment, improving the delivery of chemotherapy to the tumor. Thanks for joining us for today's episode of CLPTV, brought to you by Leica Microsystems. We'll see you next time.